we are indeed privileged to have two speakers that are going to help us get a much clearer contextual picture of that workforce, and they're going to help us understand our opportunity and responsibility of communicating these issues to our various communities. We're first joined by Nancy LeaMond. Nancy is the Executive Vice President and Chief Advocacy and Engagement Officer with AARP. She has done extensive work and interactions in communities across the country to talk about this specific issue. And she's also actually spent quite a bit of time traveling with our next speaker, someone who I have to go ahead and have my fangirl moment. The first time I saw Ajin, who was actually, we're speaking to the Emerson Collective during one of their audio or Zoom conversations. And as the president of the National Domestic Workers Alliance, I had never seen anyone so clearly and passionately and succinctly capture the challenge in America of the domestic workforce, the people that so many of us take for granted, not necessarily in a negative way, but the true engine of a society are the people who do the work that domestic workers do. So I'm just absolutely thrilled to be here, and I'm honored to lead a discussion with these two women. So thank you, Nancy and Ajin, for joining us.
Thank you. It's great to be here.
Thanks for having me.
So I want to just start with benefiting from Nancy's participation by having you really sort of thoroughly capture that figure that we've heard a lot of the past day and a half, the 48 million people in America who provide an average of about 20 hours a week of unpaid care. Give us an overview of who they are.
Well, first, thanks for being here. Thanks for having us. Thanks to you all. AARP turned the air conditioning on today, so we're able to be here. I don't know if we're on the record or off the record, but this comment is off the record. If Taylor Swift were a family caregiver, we wouldn't need all of you. We wouldn't need to have people raising the profile of the situation family caregivers and domestic workers have in America.
Nancy, you can't make us have that be off the record. That alone would get every story in this room published.
My press people are here. They have to protect me.
Okay.
But the point really is how important it is to have this topic raised, I think, in front of those of you who are able to shine a light on this important constituency. You know there are 48 million family caregivers in this country. Put it in perspective, there are 10 times more unpaid family caregivers than there are paid long-term care workers. We need more of both, but right now there are 10 times more. Caregiving is a job that doesn't discriminate. I spend a lot of time on age discrimination. This is a job where there's no age discrimination. There's no discrimination based on race or gender. 60% are women, 40% are people of color, 30% are millennials or Gen Z, and close to 30% of family caregivers are caring for both a parent and a child. I also might add that 10% are over the age of 80. So you get the picture. 61% of family caregivers are in the paid workforce. And that's why you'll hear so much, maybe today, maybe other days, about employers, their role, the issue of paid family leave. Caregivers are spending on average 18 hours a week in a job. They're typically paying about $7,000 or $8,000 out of pocket to contribute to their loved ones, and 40% say that they had to quit or cut back their work hours. This is particularly important for women because, as you know, older women are more challenged economically, particularly as they reach retirement age. And part of that is family caregiving. People don't take promotions, they have to take time off, they have to take time out of the workforce. So that's the basic profile of the family caregiver. It's almost everyone. So I ask in any room I'm ever in, how many of you are a family caregiver, have been a family caregiver, or expect reasonably to be a family caregiver?
Yeah.
This is, you're even higher than average, which you probably knew already, but the number of hands that went up. And so I think you get a sense of how dominant this is as an issue, and think about how invisible family caregivers are.
And of course, there's the extra layer, not only family caregivers, but then there's an even larger number that would encompass lower paid or non-paid people who come into homes and whatever. So it's an expansive issue.
Yeah.
People,
Yeah.
yeah.
Yeah, and unrecognized typically until very recently, thanks to the efforts of Ajin and others.
Ajin, I rather eavesdropped on your interview with Matt. So before I ask you to tell us about the National Domestic Workers Alliance, I overheard you talking about your own personal journey in this area. Would you, because you're a master storyteller, would you begin with that?
Sure, I'd love to. First of all, it's such an honor to be here. AARP has done so much to be the Taylor Swift of this issue and really amplify this urgent and important issue for our country, and I'm so grateful. So I was raised in an intergenerational household, an immigrant family where my grandparents played a huge role in raising me, and both my mom and my grandmother were in caregiving professions on top of caring for my family and all the aunties and uncles and all the people who I thought were my blood relatives, but actually were just members of the community. Caregiving was kind of in the ethic of how I was raised, and I think as I grew older, I realized that the rest of society didn't value caregiving as much as we did in my family. And even in my family, a lot of the caregiving that my mother and my grandmothers did was taken for granted and sort of expected that they would do on top of everything else. And so as they all grew older, my grandparents in particular, as they aged and needed more supports, the struggles that my family faced to find appropriate caregiving for them really showed me the range of scenarios in the Wild West of this caregiving reality. From my grandfather ending up in a nursing home room where he shared a room with 6 other people, had food that was unrecognizable, the lights didn't even work in the facility, and the workers were responsible for about 20 people each, to my grandmother, who was able to live independently in her home for about a decade, going to church twice a week, playing mahjong, really living life on her terms, until she had a stroke, because she had the support of both family caregivers and nursing home care workers. That there's just a whole range of both what's possible and what we're missing that became my obsession, and especially the people who are really passionate about caring for others, like my grandmother and my mom and the millions of family caregivers and direct care workers out there. How do we get them the support they need to care for themselves and the rest of us?
So tell us then how you became connected to the National Domestic Workers Alliance.
Right, so actually I started in New York organizing domestic workers. How many of you are from New York City? Okay, some of you. So I was a student in New York, and I couldn't help but notice the many women of color who were caring for babies who were clearly not their own, pushing white babies in strollers, older adults who were clearly not their relatives. It really became clear to me, if you just pay attention walking down the street in New York, that there is an invisible army of women of color who make everything else possible in the city, and making it possible for people to go to work in all kinds of professions, from media to corporate law firms to Wall Street. A lot of those women were women in the Asian American community, like my mom and my grandmother. And I decided to listen to them in the parks and playgrounds of New York City. And what I found was that they actually take a huge amount of pride in the work that they do, but are not compensated or valued or respected accordingly. And so 25 years ago, we started organizing first in New York in church basements. And today, we are a community of about 400,000 home care workers, nannies, and cleaners around the country in every state. And we've passed some legislation to protect the rights of this workforce in 10 states and 4 cities. And in 2011, we launched a campaign with Jobs with Justice called Caring Across Generations, which is meant to bring together family caregivers, workers, and people who need care and support to develop big, bold solutions to help more people get access to the care they need and more workers have good jobs who provide that care.
This is huge when it comes to the discussions we've had already about the need to provide professional supports, a pathway to a career for these women who do this kind of work. We'll get into more of that later. But Nancy, one of the big challenges journalists have is that when we get a report or a survey that comes across our desk, it has a statistic like we'll have more people 65 plus in America in 2034 than we'll have children. It seems simple enough, and you should be able to walk to your editor and say, this is why we should do a story on this. Yeah. But we have now the privilege of helping you help us understand truly what that statistic means. So can you help us sort of unpack this emerging trend and shift and what it's going to mean?
Sure. Well, the number on the face of it tells the beginning, which is there are roughly 55 million people in this country now over the age of 65, and we use 2040, there'll be 80 million. So think about that growth in the number of people over the age of 65, but also, we have a vision of people over the age of 65, and many of us are a little healthier, more vibrant than you might remember your grandparents growing up. The truth is, 1/3 of people over the age of 65, I'm always checking my notes, have some kind of cognitive impairment or some kind of dementia. 95% have at least one chronic condition. And so there are more people over the age of 65. There are more people living with chronic conditions that require, frankly, a lot of care. And the number of people getting illnesses such as dementia, Alzheimer's, Parkinson's, ALS, MS is growing dramatically. Again, if you want any of this data afterwards, we're happy to provide it. But my own personal experience, like many of you, I've been and due to my age, I've been a serial caregiver. So I was somebody who helped my mother take care of my father. When my father passed away, I'm an only child. I took care of my mother remotely. She lived in New Jersey. And then about, 8-9 years ago, my husband was diagnosed with ALS, and we made the decision to have him stay in our home. And we did 6 years of caring. He was incapacitated from almost the day of diagnosis, so required some care. And it really was, as Ajahn described, I was a caregiver, my 2 millennial sons were caregivers, and we had 5 or 6 paid caregivers, part of it. So the picture is, that's a big number. There's no question there's a big number. There are going to be more older folks, but it's also the way people are living and towards the end of their lives. They're going to be infirmed, have some disability that's going to require care. And we have to look at that, and we have to understand that given all the articles written about the replacement rate and how many kids there are, though I'm working very hard to increase the number of grandchildren I have, the fact of the matter is there just aren't going to be enough family caregivers And the question is, will there be enough paid caregivers, paid home care workers, to deal with this really big challenge?
I really want you to help the journalists embrace the opportunity to write about this in a way that isn't this or that. In other words, writing about sickness and decline and whatever.
Yeah.
Or the other popular end of the spectrum in newsrooms is the super agers, the people who are fit and healthy and strong at 98 years old, whatever. I mean, these are interesting stories and inspirational stories, but there's just such a broad range in between that journalists need to grasp. Would you agree?
Yeah, well, we joke all the time about the 80-year-old marathoner who everybody loves to write about, including AARP publications. But that isn't the norm. And for many of these conditions, ALS is a very unique and horrible disease where you're incapacitated almost from the beginning. But I don't know if any of you have had experiences with Parkinson's or MS. They can ebb and flow. And so you're in a situation of people having very fulfilling and active lives, and then also being in periods where they need some extra care. And I think that is a picture that we need to paint. And also, just as part of that, the very complex range of caregiving situations there are. So I remember when my husband was first diagnosed, I went to some of the AARP materials, and most of the materials were how to make sure your loved one doesn't wander away, doesn't go out the front door. You can't. My issue was not my husband wandering away. My issue was, how could I lift him up? How could I help him get out of a chair? And so my experience was in that area, others are in others. And we just have to, as an organization, we work very hard to provide a set of information and tools for people as they become caregivers.
Well, did you want to say something?
Well, I was just going to say people often forget that aging is living, but the fact that we have this huge and kind of culture-defining generation of boomers aging and living longer than ever before, we've essentially added an entire generation onto our lifespan, but not adapted any of our systems, our policy, or our culture to support quality of life for that extended period, right? So yes, we're going to have more people living with chronic illnesses, and yes, it is also possible to live well, but some change is going to be required to support that, right? And I think that's what we really need some storytelling on, is what are the policies, what are the shifts in our culture, in the way that we think about aging and living well, the way we think about care teams, right? That caring, it's not just either family members or a workforce, it's both and. And how do we support all of those caregiving relationships that are going to help enable us to live well as we live longer?
Yeah. I think you've just described what's often attributed to you, the term human infrastructure and the care infrastructure. I like the way that, to me, evokes a system of connected parts and resources and ways to look at this that so many families do not have. Yeah. Can you talk a little bit about what you mean by that?
Yeah, I love the infrastructure metaphor, and y'all can tell me if you think it works or not, but what I find helpful about it is when it comes to caregiving, most people in this country, especially before the pandemic, most people thought about it as a kind of personal responsibility. And if for some reason I can't afford it or I'm really struggling to manage it, it's a personal failure. Like, I didn't save enough, I didn't buy long-term care insurance, I don't have the right job, I'm a bad daughter. Whatever the narrative is, it's really felt as, or has been, as a crisis of personal failures, as opposed to a system failure. That there should be some safety net, some set of policies, some set of programs, and a workforce in place to support us as a fundamental part of our social infrastructure, our safety net, our programs that we collectively invest in and build as a society. And it's kind of like the reason why I think the infrastructure metaphor is so helpful is because, you know, the bridges and the tunnels and the roads and the broadband, we take it for granted that we as a society should be investing in those things because they are enablers of society and the economy to function. What could be more fundamentally enabling than access to care? Access to childcare, access to paid family medical leave, access to aging and disability care, and a care workforce who can team up with us to help make sure that our loved ones have what they need so that we can participate in the workforce every day. And we have this expectation that not only should we collectively, like as public infrastructure, invest in roads and bridges, but that they're going to need to be updated, modernized, that there's a role for the private sector in building infrastructure, that we need a workforce that is paid a living wage, maybe even has a union, right, in the project of a strong, sustainable infrastructure, that it'll have to be modernized as we go and changed, right? These are all, and kind of like infrastructure, if it's working, we kind of take it for granted, right? And that's what I think we need to get to with care. We need to understand that there should be a workforce. There is a role for the private sector, and as a country, we should be investing in these programs and these systems so that we can function well in the 21st century when most families have somebody or have all adults in the household having to work outside of the household in order to make ends meet. It's kind of like Senator Casey from Pennsylvania said it best a couple years ago. He said, you know, some people need a bridge or a tunnel to get to work, and other people need home care. Other people need childcare. And a lot of us are going to need both.
This might be a good place to talk about the issue of resources and equity, et cetera. You know, Nancy, you describing what I'm sure you're incredibly grateful for is the ability to have 5 people come in and support you and your family. And too often people think that money is the solution. If you just have a lot of money, the long-term care issue is a snap. It should be easy. Can you talk a little bit about what people need to understand about the role of, you know, money versus what people really need?
Well, make no mistake, money helps. In Washington, D.C., full-time, 24/7 home care is $180,000 a year. And if you can't do that, then you have to find a way to patch together, whether it's through family, caregivers, friends, whatever, a way to take care of your loved one. But even with that, you wake up every single day with a knot in your stomach, trying to figure out what it is you need to do. And there are a whole bunch of very basic things that we actually try to provide information to family caregivers on. How do you deal with Medicare? How do you deal with private insurance? How do you deal with the bank? How do you deal with guardianship issues? How do you deal with, think of it, all kinds of specific issues. And people need that support. And it's not always that easy to find. We have a pilot program right now with United Way 211, where in, I think, about 20 cities right now, you can call and be directed to local resources. And there aren't always all the resources people need, but at least they have a way of finding them. So I'd say, you need to have those basic resources, and then something of a guide. We have a publication called Prepare to Care that helps guide you through the steps you have to take. And Aishan's right. COVID put a light on caregiving, put a light on people, in effect, somewhat trapped in their homes, needing supports. But it's really interesting. You're in a city that is not closed down today, which was the story you were all probably following. And so we're in an environment of government can't do anything, we're in gridlock, et cetera. But it's pretty interesting, despite the fact that COVID shone a light on it. Beginning in 2014, we did work across the country in the states. And by the way, the states have been much more active in support of family caregivers than the federal government has been. And since 2014, we have more than 1,000 advocacy victories for caregivers in 53 states. They fall in a number of categories, to your point, of what's needed. Some of them have been able to do paid leave. Some have helped with respite care. Some with guardianship issues, some with relief on certain costs of care like prescription drugs, which I know many of you know is a big issue for AARP. But there has been a real, I never know what to call a movement, what actually is a movement or isn't, but there's been a huge amount of activity across the country, by no means enough, but there has been a lot. And I think it is out of this recognition that people are struggling, and people, it is always harder if you don't have resources. It is always harder if you're among the most vulnerable. It is always harder if you're a person of color. But it is also hard for people in very different ways.
Ajin, our field trip tomorrow is to a senior services center in Southeast Washington, primarily an African-American, low-income neighborhood. And the director steered us to this location versus the one in Northwest Washington because he said that's where the story is for journalists, providing care, memory care supports and dementia care and services in communities where they don't exist. So can you talk about your thoughts about the need to report on and keep the equity and access issue front of mind for journalists?
Absolutely. This issue, I think, is one of the biggest drivers of inequality that no one talks about in our country, where you have essentially lots of people who are concentrated in the caregiving experience, especially in the workforce, who are trapped in poverty. The average annual salary, the median annual salary for a home care worker in the US today is $21,000 per year. 1/4 of all home care workers are reliant on public assistance just to make ends meet. So people who are working, who want to be working, their job is incredibly important. We even deemed them essential during the pandemic. And they don't earn enough to take care of themselves or their own families doing this work. So you have a workforce that is trapped in poverty, which also leads to high rates of turnover because people can't make ends meet. And we're seeing right now, it's just incredibly hard to recruit and retain workers, especially as in other parts of the economy, tight labor market is making wages increase slowly in other low-wage service jobs. I'm hearing from direct care workers every day who are saying, caring for older adults is my calling in life, and I have to leave to take this job working at the gas station because I can make more money, and I am tired of having to decide between putting gas in my car to get to my clients and food on the table for my families. So I think there's a whole question of why we have not valued this workforce that is so essential. And by the way, fastest growing occupation, consistently top 3 categories of fastest growing occupations in the entire US economy, home health aides, personal care aides, all in this category because of the huge demands on the part of a growing aging population. Some economists are predicting that by the year 2032, home care or direct care may be the largest job category in the entire US labor market because of this dynamic. And they're currently poverty wage jobs. The flip side of that, imagine if we could make them living wage jobs that you could sustain a family on, where one generation could do better than the next. The ripple effects of having the ability to retain a strong care workforce would not only benefit those workers who are over 80% women and majority women of color, right? Retain that workforce, support their families, plus the double benefit of enabling all the family caregivers and other people who rely on their services to get to work. And then the triple benefit of a quality of life for the people who are actually receiving that care. The ripple effects of good jobs for the care workforce are enormous. So that's the upside of this. Now, not to mention, on the consumer side, in terms of affordability, the fact that the only long-term care program available in this country is a program that you have to deplete all of your assets in order to be eligible for is a huge challenge. There's a huge swath of people in between the people who can afford long-term care insurance, which is only like 1 in 10, and the people who are eligible for Medicaid, which is people who've completely impoverished themselves to be eligible. The vast majority of Americans are in between. And we've got to figure out a way that we support them. Otherwise, there will be this downward pull that will contribute to inequality, to your point, and will disproportionately impact people who already have less resources and less power in society. So again, on the flip side, it's like there's huge opportunity if we face and address these issues head on, from a policy standpoint, from a cultural standpoint, from a solution standpoint. The ripple effects in terms of making our economy more just and our society more democratic are huge, huge.
I'm going to, before I open it up to questions, once again take advantage of this level of expertise that we have here and bring a scenario to you that I've brought to our other speakers, which is the issue of competing interests. So when it comes to what seems to be common sense policies that this country should have, that are simply humane and just make sense, there are competing interests, people who it would not benefit to have common sense policies and do whatever. So Nancy, I'd really love to have your take on this as somebody who has been in the advocacy and engagement realm and interacted with people at high policy levels. How do we overcome that incredible challenge?
I have my theory. I don't know if it's reliable.
Look, don't tell us anything else that you won't let us use.
Yeah.
Okay? You got great stuff here. And
I think long-term care is one of the great challenges facing the country right now.
Yep.
There is no question about it. People are just not. How many people do you know are really prepared for this tremendous cost, both emotionally and financially, for what could be 10, 20, 30 years of their lives? We're just not prepared for it. I served in the advocacy arena for many years, and I can tell you when we did the Affordable Care Act, we finished it, very controversial as everybody knows, and those of us who, day jobs or advocacy kind of sat down and said, okay, well now we've done access to care. The next issue we'll be dealing with in a couple of years is long-term care. And indeed, since the Affordable Care Act has passed, what have we been doing? We've been dealing with the Affordable Care Act. So, I think as these policy debates go, long-term care got pushed aside. Second, there are a lot of, to your point, there just are a lot of competing interests. And Aijin can go through the dynamics in the IRA more than I can about the home and community-based care provision that dropped out. And frankly, had a lot of support, but was dropped out. And I'd be interested in your view of why that happened. But there isn't the will at the moment, I think, to really tackle this. It's so complicated. It's very expensive. There's also grains of a debate, and this I will say off the record with apologies. As you interview people and talk to them, I think you will find, as I have in the last year, much more of a discussion. It's never clearly articulated, and it's never said with any kind of negativity on either side, but it's, should we invest in childcare? Should we invest in elder care? And we don't ever want to drive a wedge in that discussion at all. But there is something about with fixed resources, where are we going to put our investments? And I think this is something to watch. Everybody is well motivated, but in a world where there just aren't enough resources, that's the reality. What will happen down the line, I don't know. We've made a lot of progress this year, frankly, mostly behind the scenes. The president put out an executive order that included family caregiving. The Center for Medicare and Medicaid Services has taken a number of actions. You have to be a cryptologist to actually find all of them on the website. But they are important steps. For the first time, they recognize the family caregiver as a key part of the healthcare delivery system. The proposal is to provide training, to provide reimbursement to docs and nurses who train family caregivers to do their job. It requires hospitals in their discharges to make sure they've educated the family caregiver. It requires any number of things like that. So we're making some progress, but I don't know. Ajahn, give us your view on why HCBS didn't make it to the finish line.
Well, I would say that this issue as a political issue, I would say that we have made a huge amount of progress in the policy narrative, where we built a tremendous amount of consensus for investing in home and community-based services and childcare and paid leave, a lot of support and momentum, and actually the coalition of people working on all three of those issues worked together and stuck together, even as these wedges were attempted to be driven. We won the policy narrative. I think the political narrative, where elected officials would understand that there would be consequences for not moving it forward and huge advantages to championing it, we have yet to really establish. And that is the work of 2024. And I will tell you that it is going to happen, because talk about a kitchen table conversation. There is not a kitchen table in America where people are not talking about care. What has not yet happened is connecting the dots between the pain points that they're experiencing, actual policy solutions that can provide relief, and voting. And that's the connection that we have to believe that we deserve long-term care in this country, that we deserve a care infrastructure to support us, to take care of the people that we love while we're working and contributing and doing all the things, doing our best. And we have to let our elected officials, our candidates, know that they have to champion those solutions, or there will be consequences. And I think that's where we need to take the conversation next. And honestly, the amount of progress we've made on the policy narrative front has been so inspiring to me. I mean, literally, in a matter of years, we took this issue from number 4 in the top 3 priorities to actually in the conversation about the top 3 priorities. And it is one of the 4 pillars of the Biden economic agenda, not the aging agenda, not the women's agenda, the economic agenda. And it is holistically about the workforce, family caregivers, and what families and consumers need. I think we've made a ton of progress here that's not just about putting the issue on the map, but the depth that we need in order to get to solutions that work. Now we just have to put the political power and the muscle. People have to really demand these solutions, and they are. We just have to amplify and make sure that their voices are heard. And that's why it's so important that you all are here interested in these issues.
I want to open it up to questions now. So why don't we start with Whitney? Where's the microphone?
Hi, I'm Whitney Downard. I'm with the Indiana Capital Chronicle, and I just looked up the National Domestic Worker Association, and I don't see any chapters or affiliations in Indiana, unfortunately. So my question is kind of, how do I connect with these frontline workers who are doing this work? And if I'm not going through some sort of affiliate organization like this, how do I make sure I gain their trust to know connect with them so they trust me to tell their story.
There are organizations that we work with. They're not organizing domestic workers in the way that our affiliates are, but we work in partnership with a number of groups in Indiana who I can connect you to talk to people for sure. Absolutely. And I think from the standpoint of building trust, trust can oftentimes be conferred. And so if you're working through a local trusted organization like a community organizing group or a service agency where caregivers are going to for support and resources, oftentimes that'll give you the kind of access that you need in order to have the kind of trusted relationship or conversation that you're looking for. So I think that's the best way to do it, is to work through local groups.
But you bring to mind a good point, which is so many of us as journalists, we do need to find these stories. We do need to include these voices, but we sometimes can't break out of the mold of, I do need to reach or do it through an organization or whatever. Talk about the need to look around us and see the guy next door or the person across the seat from us at the office who may be dealing with this. Is that a way to?
Absolutely. I think care is everywhere. I spoke to a New York Times reporter who was reporting on the childcare crisis and literally just started to put the word out through social media and through kind of informal social networks, and then also reached out to organizations like mine for contacts, and we all kind of reached out to our friends of friends in addition to our professional contacts, and she got a really good collection of different kinds of leads. And I think it is what Nancy said. Everyone has a care story, and this is something that everyone's dealing with, and so you don't have to scratch too deep beneath the surface to find that really proximate to where you're sitting.
I might also, we have a story collection operation, as you might imagine. We might not have the exact location or situation you're looking for, but we have a pretty extensive way of reaching out. We have offices in every state and are happy to help with that. We also, because our media people are here, do provide stories to the media, and in most cases we try to ensure that we've done some level of vetting in order for people not to have to do all of it. You obviously want to do your own, but to have some basic vetting done.
You're reminding me, Emily, that we have actually a handout that might be appropriate to spread around at this point. Mm-hmm. It is of resources or remind me, that's a fact sheet for each of the states from the scorecard, from the long-term scorecard, that will help you start to really drill down on what's happening in your own state. So Emily's going to, or she just handed off the folder. Look and find your state amongst all of the different ones, and then pass it along to the next journalist. And so, more questions. Let's wait for the microphone. Oh, you got it?
Yep.
Oh, okay, sorry. I'm sorry. I didn't see.
No worries. I'm Jesse Hellman. I'm with CQ Roll Call. Whenever I'm working on these stories, something I think about a lot is just, why can't we just pay these people more? There is money out there. Medicaid is the largest payer for some of these services. And I was wondering, with the Biden administration's proposed rule, I think it would require 80% of Medicaid funding on home and community-based services to go to paying workers. What impact do you think that would have? And do you have any idea about what, if it's not 80% now, what is it? How much is actually going to workers, and where's the rest going? Is it administrative costs, or what does it currently look like?
Great question. I think the proposed rule will make a huge difference, and that was the goal of that rule, is to make sure that more of the reimbursement rate goes to workers to help address the poverty wages in the sector. And 70% of the home care workforce works through the Medicaid home and community-based service programs. So this measure, if implemented, would be hugely transformative. And it will also help ensure that should we achieve another tranche of funding down the road, as we hope to do, that that the mechanism will be in place to ensure that workers are also going to benefit from that increase in funding. Additionally, states oftentimes have to enact a mechanism to ensure that the reimbursement to states, a percentage of it goes to workers, and we've been working on that in a number of states like New Mexico and North Carolina and others. So that is all crucial. In addition, there needs to be more funding to the Medicaid program overall. And I think that the proposed funding, for example, in the Better Care, Better Jobs Act that Senator Casey and Congresswoman Dingell introduced, would do just that. It would infuse Medicaid home and community services with funding that would expand access to services for families. There's about 600,000 people still on waiting lists who are eligible for services who can't get access to them. And it would help to raise wages for the workforce. And that is exactly the kind of thing that we were hoping to achieve through budget reconciliation, that we're going to continue to fight for.
I might add one quick thing, which is, there's a cottage industry of high-tech startup groups looking at the whole aging population and caregiving. And there are a number of them that are trying to do, rather than the home care agency in the community, online. And at least 2 or 3 of them that we've talked to are looking to raise the hourly rate by reducing the so-called administrative costs and the profit margin. I don't suggest that that's a solution, obviously, to this, but it is interesting in the workforce area. The other, for roll call, you said? Did you say? Yeah, I don't know if this is true, but I heard from 2 or 3 people last week that they've been in the closed door sessions on workforce generally, conversations about workforce, as we look at various industries that are kind of underpopulated, and there has not been as much discussion about home care in that arena. Yes, in the Medicaid arena, but not in this broader arena. I don't know if that's the case, but it's very interesting and speaks to how some of these issues get bifurcated or trifurcated and parked in one area when it really relates to others.
Mm-hmm.
Hi, Andy Richards, NJ Advanced Media. I guess, I don't know if this is a question, but I feel like our country is in a state of youth. We feel like we're Peter Pan. Like no one is really accepting the fact that we're getting older and our country's getting older and things are changing. It just seems like we're stuck in a certain mindset that makes it really hard to address these issues in a logical way. And I guess part of that is we see the states trying to adapt, but our federal government is not as willing to adapt, and I'm thinking that's because of our system of capitalism. So how do we get I guess participating in this and hearing all the speakers, I keep coming back to that. I'm like, well, what if it's not Biden or someone who thinks like him next time? What if I don't have Governor Murphy as the governor of New Jersey next time? Yep. What if it's someone who doesn't care about workforce issues or, long-term care or, anything that has to do with humanity? So, how do we keep doing the work without getting depressed?
Can I just quickly jump in to say that, the theme of last year's training was age discrimination, ageism, the aging workforce, et cetera. And so I think you bring to mind once again, the term competing interests. I think as a society, the major interest, capitalist, whatever, is youth and vigor, and that's what's valuable and that's what's important. And so that has to, I would say, contribute at least indirectly to the lack of focus or, elevating these issues and making them Am I on the right track?
You first.
Well, yes. I think it's funny you mentioned age discrimination. This morning I was going to send a note to my team, but they hate these Monday morning missives. And it was going to be, really, why have we not been able to pass an age discrimination bill? And I'm not talking about massive, I mean in the last 9 years. We've been working very hard on that. And I don't have the answer to that, but there is something going on in the kind of view of where our resources should go. What I'm struck by with the family caregiving piece of this, and I spend more time on that than home care workers, is increased recognition. Most of you are not over the age of 65, and most of you put your hands up about being family caregivers. I think the fact that family caregiving is becoming such an intergenerational issue, people unfortunately are getting sick earlier in their lives, it may help change that dynamic a bit, but there's no doubt that many of the debates come down to kind of stage of life, as opposed to other factors.
I will say too that objectively speaking, I think we have a lot of reason for hope because one, this whole category of, for example, the sandwich generation caregiver. First of all, I think that metaphor is too gentle, like a sandwich. It's actually more like a panini. Right? Yeah, exactly. But that identity didn't exist before, and now it's common, right? A common identity language, and that generation of people who is experiencing this pressure on both ends is becoming more and more powerful and prominent in shaping the discourse in our society. More men are caregiving than ever. That data point that Nancy shared about 60% women. I mean, I've been going around the country saying, quoting this social scientist named Jessica Calarco, who said, other countries have a safety net, the US has women. Because of how disproportionately held these caregiving responsibilities have been by women. But actually that data point of 40% are men is huge. And so between more men caring for their aging loved ones or disabled loved ones and more young millennial fathers playing more of a role in raising children, like I think that a lot of cultural norms are shifting in a way that lends itself to real change. And I recently talked to some of these, Chris Hayes, I did Chris Hayes' podcast, and he said, if you think about it, this issue has actually ripened much faster than it probably was meant to, probably helped by COVID. But if you look at the trajectory of the Affordable Care Act and healthcare reform, which people like Nancy really fought for so long, we came a really far distance on these issues and these solutions in a relatively short period of time in terms of where they currently stand in the federal policy conversation. So I feel like between that and the material reality, which is that we cannot continue to pay for these things in such expensive, inefficient, ineffective ways, right? People talk about the cost of care from a policy standpoint. When people are paying $180,000 out of pocket, or like the cost of a private room in a nursing home more than $90,000 a year, and 60% of the American workforce earns less than $60,000 a year, the numbers actually just don't add up. We are paying in incredibly costly ways that are inefficient and ineffective. We've got to figure out a collective solution here. So I just think it's coming. It's just a question of how big, how bold, and how soon, in my opinion. And partly those three questions are about how much we as a country demand it.
Aisha, before we get to you, has brought to mind another sort of tool in our toolkits as journalists that I want to remind us of, and that is, we've all heard the saying that your editor will tell you, dog bites man is not a story, but man bites the dog, now that's a story. So she just mentioned the fact, the male caregiving piece. I feel like, again, each of you could walk back into your newsrooms on Thursday and pitch a story about the increase in men like Sandeep Jauhar leading the way in family caregiving. And you probably get a good response from him or her. They'd say, oh, that's an interesting story, let's do that. So we have to be creative about getting these stories over the transom into our newsrooms. Who was next? Kathy, did you have? Oh, okay. And then Kathy.
It's Nina Keck with Vermont Public, and I wanted to kind of riff off something that Andy was just mentioning, and the fact that you say things are changing. And you mentioned the Better Care, Better Jobs Act is it the Senate Committee on Aging or Senator Casey's group?
Yes. Mm-hmm.
It seems to me that the whole caregiving situation, unlike childcare, where conservative or more fiscally conservative folks might say, well, you chose to have a child, so you should pay for that child. We're all getting older. We're all going to need care. I'm struck that this should not be a partisan issue, and I'm wondering if we're so partisanly divided right now. You know, if the Democrats say this plan, the Republicans won't do it. If the Republicans present a plan, do you see any meeting in the middle on this particular issue, and with the members of Congress that we have right now?
I think it kind of depends on what part of the issue you're talking about. So on family caregiving, there's an enormous amount of bipartisan activity right now. We have several bills being introduced this fall, all of which have bipartisan support. The place where you begin to get a divide is not in the policy. I agree there's progress on policy, there just isn't any progress on actually getting anything done. And that's where you find a real debate on the cost. So for example, on a caregiving tax credit, you get a lot of people focused on it being a good idea, people need help, but then you look at a price tag and it divides. And it divides not only along partisan lines, but that's part of it. But there is a lot of bipartisanship at work, and the question is kind of how to move some of it, particularly on the family caregiving side. On the kind of paid worker side, I think it's a little different, but I'm anxious to get your
I think that's right. We have because the workforce crisis is so sharp in so many parts of the country, where providers are pushing Republicans around addressing the workforce crisis. We have, at the state level, actually been able to get some support from Republicans for wage increases, like in places like North Carolina, for example. But I would say that has not been as common as one would think. And when it comes to raising wages, that's a harder sell from a bipartisan standpoint. Well, we lose a lot of our best caregivers from this sector because the job quality, which isn't just about wages, it's also just about treatment, respect, how we value this profession. It's a lot of different issues, but I mean, for most of the people I talk to, the fact that these are, they feel like $11 an hour isn't enough to pay the bills. I mean, it's just a material reality.
In terms of partisanship, we shouldn't lose sight of the fact that the big debate on home and community-based services last year was in the reconciliation bill that was all Democratic and highly partisan. And so you have an issue that is not necessarily partisan that gets framed that way, and it's very hard to dig through.
It isn't at the grassroots level. So people in the community, Republican, Independent, Democrat, all support home and community-based services, even support an increase in taxes to pay for long-term care.
I think the conversation we were having reminds me of a question that I wanted to make sure to ask you, and that is about activism, advocacy, the kind of grassroots work that you do to elevate this issue. I'm wondering how it's been affected over the past several years, what with the racial reckoning and all of the sort of societal implosion that came around George Floyd's murder. I wonder if your ability to elevate these issues and to get people on board has been affected.
I think it's been a mix. On the one hand, people are very activated and attuned to injustice and inequity, certainly in the caregiving space, and people really mobilized around the campaign for budget reconciliation. It was a beautiful coalition that came together of all the aging and disability groups and the unions and the family, everybody coming together in an unprecedented way. And I think that is paralleled in the States. And I also think that there is a mental health and emotional health kind of epidemic in this country, where I think people aren't well. You know, people are feeling alone and a little bit overwhelmed and cynical. Rates of depression are going up. You know, there's all kinds of factors in our collective mental and emotional health as a country, and that also feeds the dynamics. So I think both things are true, that people are more activated around these issues than ever before. And we are also the same people who are on the front lines of all of these mental and emotional health issues that I think have been plaguing so many communities, especially low-income communities, where there are less resources around these things.
Nancy, I want you to speak to the role of caregiver supports and mental health supports. These are things that are absolutely crucial for families around the country. Is that correct?
Yeah, if I can go back to advocacy first. We passed 1,000 bills since 2014. You don't pass that many without a constituency. And it is possible to drive a constituency. My view is it's an economic issue. That's how you motivate people. It's kitchen table, and it's concrete. Is it a guardianship bill? Is it paid leave? Is it a caregiving tax credit? And that has been very successful. We've been very successful across the country. If you had told me at the beginning of last year that our big victory this year on caregiving tax credit would be in the great state of Oklahoma, I would not have believed you. That turned out to be the case. What has not translated to the points made earlier was the federal level, where it hasn't galvanized yet around significant, I would say, federal legislation. Ajahn said we have 2024 to try to rally people, and we will. It's going to be one of the two issues. AARP is going to ask everybody running for public office, what's your position on Social Security? What's your position on family caregiving? And we're going to press, and our job is then to let our 38 million members and our 50 million constituency know where people are. But it takes a lot of energy. This issue also doesn't have something that I can tell you, having done prescription drugs. It doesn't have a clear enemy that people really want to counter. And that makes it a little harder in the advocacy space. To your point on mental health and other kinds of supports, we need to be looking for those supports, not only for caregivers, but the people they're caring for. And there is increasingly a bipartisan debate around how to provide more benefits in the mental health arena. I know Medicare debate a little bit better than the others, and I think we will see some movement in that area. Part of the discussion around telehealth, we invented telehealth during COVID. It had existed before, but we did one very important thing during telehealth. We paid doctors to use if they use telehealth. And so now we have that as a medium. That's going to be a very powerful way to drive more support, I think, in the mental health arena.
I'm Marquita Brown. I am a freelance writer, an editor based out of Northern Virginia. Out of Fairfax County. But I wanted to get clarification of a stat that Nancy, you gave earlier in the beginning of the discussion. Did you say that 10% of family caregivers are older than 80?
Yeah, around 10%. We can get you the precise information.
Thank you. And then the other question that I had was, with several of the speakers, this fact came up about how the only federal option for family caregivers, I think, is to deplete all of your resources before you're eligible, right? But I wanted to get a better sense of the scope of what we're talking about and how much that might vary from state to state. In K-12 education, there's this idea that your zip code can dictate a lot of what you get in terms of access to quality education, right? To what extent are we seeing that same thing in terms of aging, long-term care, that sort of thing?
Well, I'll start, but it's more Ijan's area. The only large-scale program in this country for paid home care is through the Medicaid program, Home and Community-Based Services. And as you know, it's not a required part of the Medicaid program. Under federal law, there are requirements for the Medicaid program. It is not required. It's an optional service that a state could provide, to your point on zip codes. So some states have not been as active as others. There were incentives provided during COVID to get more states to engage with home and community-based services. But this is Ijan's portfolio, probably more than mine, but your premise is correct. Where you live can influence a lot the benefits you get from Medicaid.
Mm-hmm. And I would just add that each state has different laws in terms of, each state handles their Medicaid program differently, and so there's just more options and more infrastructure in some places as opposed to others, including training for the workforce. And there's actually no national training standard for home care workers, which is another issue and a reflection of how little we value the skills associated, I think, with this workforce. So that is another thing. I think that the most Americans, and I don't know if you've ever polled on this, but a lot of people believe that Medicare covers long-term care. And it doesn't. As Nancy said, the only program that supports long-term care in any scaled manner is Medicaid. And so that's a huge myth that we have to bust, because I think a lot of the reason why people find themselves suddenly in crisis is because of this lack of education on this issue.
We used to poll every year on whether people thought Medicare covered home care, long-term care, and 85% said it did. And so I decided we're just wasting money if every year they say that. How about put it into education?
Right.
I think we've been trying to do a lot of education on this, but it's very tough. People, nobody wants to think about it, and everybody believes Medicare covers a lot of stuff, but it doesn't.
Just, you said a little bit ago that we pay doctors to use telehealth, but don't we pay them? Like, I pay my doctor, like I go see her when I do a telehealth visit. Is there something in addition to that she gets?
During COVID, the decision was made to reimburse doctors who did visits through telehealth. That had not been uniformly the case before, and it's carried, even though at some point soon I think the telehealth provisions expire. My guess is that will continue. Many insurance companies did cover telehealth visits with doctors before, but Medicare did not. Before COVID.
Okay.
Yeah.
Thank you.
And again, I can get you the absolute letter on this, but that's my recollection.
As we begin to wind down, one thing I ask of all of my speakers and panelists is give us one or two ideas for stories that you would like to see in your paper or here on NPR tomorrow. Have you really thought about what you could convey to these journalists as important stories that they can produce? Or that you'd just like to see?
Yeah. I would love to see more reporting on the day-to-day experiences of caregivers, right? Both family caregivers and professional caregivers. Because I think people really underestimate what is required to do this. And I know for the professionals, one of the things that President Obama did when he was running for president was spend a day with a home care worker. And it made such an impression on him. It led to his work at the Department of Labor to bring home care workers under minimum wage protections. But I think that there is a need to really help people immerse in this reality that is so hidden until you're in it. And the incredibly impossible choices that care workers have to make between their work, their dedication to their clients, and the health and well-being of their own families. That set of impossible choices, I think, is really underreported on.
Nancy?
I'd like to see some recognition of what these states have done. You mentioned your governor and others over the last 6-8 years. There has been very substantial progress. It's not enough. It's not meeting as much of the problem as we'd like, but there's been very substantial progress. And we don't ever really celebrate things that have been accomplished. We mostly look to what still needs to be done, which gets me to my second point, which would be the whole nature of medical care and delivery is changing. So think about that. I was on a task force at one point. They have to put people who represent various groups on. And a number of leading doctors from across the country were commenting on people coming into the physician's office, the primary care office. And I came back and I talked to a bunch of our members. I was at one of our events, and most of them said, oh, I don't go to my doctor. I go to the pharmacy, I go to the health fair, I go to the urgent care center. The whole nature of how care is being delivered is changing. And I think that's a very interesting dynamic. Second, family caregivers are, and we thank CMS for this, we thank the president for his executive order, they are for the first time being recognized as an integral part of the care delivery system. They are there with the physician assistant, with the nurse and others delivering care. They're doing feeding tubes, they're doing injections, they're doing management of medications, they're organizing telehealth visits. I think that's also a huge story. Third, I hope you will cover during 2024 the efforts of groups like IGEN and AARP as we try to galvanize people. In our case, it'll be very focused on the economics of family caregiving, the economics of care, and how people need to understand that and ask people running for office what they're going to do concretely. We joke all the time when you ask people about Social Security, they say, I'm going to protect it. Well, protect covers a lot of things,
right.
Including some people would say not protecting it. Same is true in family caregiving and how to push it. I have a lot of experience with advocacy issues over a lot of years, but 22 years at AARP. This is in many ways the most challenging because caregiving is viewed as so intensely personal. To the point you made earlier, it's not, something you're supposed to do. You're a daughter, you're a son, you're a friend, you're a child, whatever. And so galvanizing people on this agenda is very challenging. And I can say that on behalf of, the biggest advocacy organization in this country. It is very, very challenging. We are putting every ounce of our energy into this in the next election cycle because we believe it's a hugely important issue. We believe it's a gateway to a broader debate on long-term care. It's the way we figure we can get to it. And the time is now.
I have two more.
Sure, go ahead.
There's Nancy inspired me. One is about the home and community-based service investment that was in the American Rescue Plan. Okay, so this is super wonky, but in the American Rescue Plan, there was an investment that was made into Medicaid to stabilize access to home and community-based services. It was initially about $12.7 billion, but because it's a federal match, it's actually come out to be more closer to $30 billion. And every single one of the states, all 50 states, took up that funding. So a lot of people were concerned that it would become very partisan the way that the Affordable Care Act and Medicaid expansion in the Affordable Care Act became very partisan. This, not at all. All 50 states took this funding because I think they all recognized how urgent and important it is to invest in these services for families. And a bunch of those states took that money and used it to enhance wages, either temporarily or in a permanent way. And so to follow some of those stories in those states would be great, to hear about how the impact of those investments, because I think that that helps us make the argument more long-term for these investments. And then the other piece is the immigration dimension of this story. There are tons of immigrants who are in the care sector, who are a huge part of our care workforce, our family caregivers, and they're going to be a huge part of the solution to the long-term care crisis in the future. Only we are not investing in them, and I think we're heading into a year where immigrants are going to be used as a political football. But I think a way to cut through that is to actually tell the human stories of how immigrants are actually caring for the people that we love in this country at scale, and are going to be a huge part of how we meet this need going forward.
We all know that one of the biggest stories today in journalism is the erosion of local journalism. And so as we wind this session down, what I'm so excited about and grateful for in this discussion and with the overall collaboration with AARP is that it's what I said last night. I think we're trying to develop a cohort of journalists who have a really strong grasp on this issue and expertise. So between last year and this year and conversations like these, I think we're well on our way to supporting journalists in truly interpreting these issues in the correct way. And I just want to take this opportunity to thank Ajen and Nancy for joining us this afternoon. Let's please show them both our appreciation.
Thanks for our great moderator.
Thank you so much.